Hello, my name is Brakoulias. I'm one of the staff specialists in psychiatry here at Nepean Hospital. And today I'd like to talk to you about what is a journal club. This talk aims to promote the practice of journal club amongst our colleagues. At the moment, I'm the coordinator of the journal club group amongst psychiatrists and psychiatry trainees in the mental health centre. But we think that having a journal club would be useful for also other members of the team. So maybe social work, occupational therapists, nursing staff that have an interest in improving their clinical practice through understanding the scientific literature. So I've written a few points. I've tried to define what a journal club actually is. And the best definition I could come up with is that a journal club is a group that meets at regular intervals. So in our case, we meet every week on a Thursday, and we discuss articles that have been published in scientific journals. The group consists of like-minded peers, so it's probably good that the group is made up of people that are interested in mental health, or psychiatrists or nursing care, so they have some focus of interest. And we try to find out the latest research through the articles in the hope that this will improve our clinical practice and keep us up to date with the scientific literature. There are several purposes of a journal club. And we find it very helpful to keep up to date with the literature. We find it helpful in our practice of evidence-based medicine. It really enables us to continue our continuing medical education or continued professional development, and so it's important for our points when we have to demonstrate that through our college. We actually learn critical appraisal skills when we are reviewing articles. It makes us more able to look at an article and say, this article is really not very good, or this article is actually very good and we should be taking note of these results. It also is a collegial thing, so we meet amongst colleagues and we have a bit of a discussion about the paper, and we get other people's views on what they think about the paper so that we reach some consensus at the end. So we can say that, yep, whatever is shown here, this is really good, this is going to be useful, this will help us with our patients, or no, this paper really didn't help at all. I don't think it's going to change our clinical practice at all. So these are the key points of why a journal club is important. The next question is, how do we actually conduct a journal club? So as I mentioned, I coordinate the journal club here at Nepean, and so there needs to be someone who is nominated to coordinate the group. The coordinator drafts the roster where they assign presenters for each week of the meeting. The presenter that's assigned for that week will then need to look for a paper that they find interesting, and usually they choose a paper either because they've read it and they think, gee, this would be great to present to my colleagues, or they choose the paper because they have a clinical problem. They've got a patient that they're not quite sure what the best evidence is in terms of treatment, and they look up and they find a paper that they want to present to their peers and get some feedback on. Some journal clubs also assign topics and types of papers when they go through the roster, so that week to week one presenter might present a topic on schizophrenia, and another week they might be assigned for mood disorders, for example, and we're talking about psychiatry here. Also, because some people might have a preference of only looking at meta-analyses or randomized control trials, some groups actually assign different types of studies for each presenter. The length and frequency of the meetings are usually determined by the group, so we run our meetings for about 30 minutes, allowing 15 minutes for discussion afterwards, but sometimes the college has some sort of training requirements for the length of the meeting. The presenter, once they've chosen their paper, will email the paper to the coordinator that then distributes it to the other members of the group, so that the other group members can read the article before the group, so that they're well prepared and they can contribute to the discussion about the paper. The presenter also usually presents some PowerPoint slides just to make the points clear to the group, and so it's professionally presented. The slides usually start with a brief introduction to the article and the reasons why the article was chosen, and we usually follow the PICO format, and I'll explain what that is in the following video. We also critically appraise the article in a systematic way, and again I'll bring that up in the following video. But to conclude, Journal Club is a great way to keep up to date with the latest research. It also enables us to critically appraise research with our colleagues and to agree as a group whether our clinical practice should change as a result of new research. Thank you.